When we're preparing for an exam or we are preparing for a presentation, it's easy to get overwhelmed. There's lots of content we're looking at. Maybe there's multiple articles when it comes to a presentation. And for our students, they can feel that way too. We're talking about what are some strategies that will help you decrease your cognitive overload when you're on your journey to become an excellent nurse educator and when your goal is to achieve that passing score on the CNE exam. And we don't want to leave our students out, so we're also exploring competency two related to the NLN nurse educator competencies. What are those evidence based practices that we should be bringing into the classroom to create the best learning experience for our students? Welcome back, everybody, to Dr. Sellars Educate, where our mission is simple. It is to support all nurse educators on the journey to achieve excellence. Now, for some colleagues, that's CNE, others it may be CHESI, or maybe there are nurses out there that are thinking about what are your next steps going to be to become a nurse educator. Or perhaps we have some nurse leaders in the room that are thinking about the CNML, which we also offer. Well, this is what we know. First and foremost is the number one reason why colleagues are not successful on exams is because of lack of proper preparation. That's no surprise to you all, I'm sure, because that's what we tell our students, right? We tell our nursing students they have to be properly prepared in making decisions that are going to lead to the safest patient care. 60 days is all the time that you need to achieve that passing score on the CNE exam. However, it takes and really requires a two-step process. First and foremost, you have to have the right resources, okay? So we're going to go ahead and talk about those. This is a must-have. This is Billings and Halstead Teaching and Nursing. This is the 6th edition. The 7th edition is available, but the reason why we use this one is because in 2023, when the blueprint was written and the questions were developed initially, this was the one that the exam writers used, okay? But there's not a whole lot of difference with the 7th edition, and we actually have the crosswalk right here in the description. The second resource, which is optional, but it is included in our 60 days program, and that is Dr. Caputi's CNE review book. This is a great Cliff Notes version of how you get ready for the CNE exam. It's not a must-have, but it is definitely a nice-to-have, and that is also included in our 60 days program. Now, the other consideration I want you to remember is when you're on this journey and you're moving forward, don't waste time with other resources. Okay, I know it can be tempting, and depending on which social media platform you're a part of, you can see that question that comes up: what should I use to study for the CNE exam? Don't get distracted by the noise. Billings and Halstead is what we call our Bible when it comes to getting ready, not only for the CNE exam, but what is required for us to be a really good nurse educator. Billings and Halstead is always going to lead us down the right path. And one point I want to make is when it comes to resources, our goal is to really compress time, right? That's our goal, to compress time so that you're not wasting time reading chapters or reading content that's not going to help you achieve that passing score on the CNE exam. All right, so let's give you an example. If you turn to page 30 in Billings and Halstead, you are going to see the Kolb framework. Now, David Kolb talks about the importance of students engaging in all 4 phases of the learning journey, and ultimately, we're partnering with our students to help them bridge that theory practice gap. So our goal is that we're decreasing that cognitive overload first and foremost by using the textbook to ensure that we are aligning and really mapping our exam questions and our content in the class to the learning objectives. And we're scaffolding, we're building on prior learning by making sure that we are having conversations and validating learning across all levels on that taxonomy. Bloom's taxonomy is another area that you must be able to not only memorize, but have the deep comprehension about. So that requires you to take a look at pages 188 through 190, and that's where you're going to see the 3 learning domains along with the taxonomy for each. All right, so you want to know the definition. So hopefully you've already pulled out your study worksheet and you've written down the date. I know because I'm going in quick. And then you're going to write down what's the one learning objective that you want to walk away with. All right, so you have your sheet of paper. You've written those 2 things down. You've already written down page 30 for David Kolb Experiential Learning Theory. You've written down pages 188 through 190, which is the 3 learning domains. You've also written down that you have to be able to understand the definition of the learning domain, the learning that happens with each level of learning as we progress and really build on our prior learning, also known as scaffolding, up to the very top of that taxonomy. When you look at cognitive learning domain, you will see that remembering or memorizing is that lowest level, right? But students can't stay there. We have to help them progress to higher levels, ultimately to the highest form of cognitive learning, which is creating. All right, so that's what you want to do. Again, pages 30 and 188 through 190 is going to give you a really good solid foundation for our conversation today. When we talk about CNE readiness, we're going to explore what's working right now. Okay, so what's working is staying focused, all right, which is what we're doing in this snapshot. What is not working is looking at social media to really make decisions for you about what your journey should look like. Now, we know that there's advice that colleagues can give. However, that doesn't mean that that will work for you. This is why it's really important to understand where your knowledge level is today related to these competencies. We're exploring exactly what are these top 10 exam steps and tips that you want to consider as you're moving forward on your journey. So first, we're going to start with 3 strategies and tip number 1. Okay, so this is part of a journey that we're going on together to explore exactly what you're going to do in order to ensure that you are choosing the best path for yourself. 74%. That was the percentage of colleagues in 2025 that actually were successful on the CNE exam. NLN does not disclose if it was the first, second, or third attempt. And we also know, based on this data that you see on my screen, for CNE, there were 1376 registrations. 26% of those colleagues did not pass the certification exam. We have consistently a 97 to 100% success rate. And right now we're at 99%, okay, for the CNE exam. And for the CNE clinical, we've consistently been at 100%. For CNE PV, we have helped some colleagues on that journey. We haven't heard yet how they have met that requirement, if they have been successful yet. And then for CNE novice, we've always had 100%. It varies. We always want to know from colleagues how you've done on that exam. So if you're in any of our programs, I'll put a plug in right now. Make sure you let us know when you achieve success so we can celebrate with you. The only way that you want to achieve success is if you quit. You have access, once you register for our programs, you have unlimited, indefinite access that never expires. And let me tell you why that's so important. Because we know life happens and we can get off track for a number of reasons. So we want to make sure we have the most current information. So we update our curriculum every single year, or if there are changes that are released by NLN or Billings and Halstead. And then because life happens and things shift quickly, you want to make sure that you have access not only to the current information, but also we don't want it to expire, right? Because life gets off track, you have to pick up another course, and we want to make sure that you have the information that you need in order to be successful. This is why we have our success framework. So when you take a look at it, what you're going to see is experience is the foundation. That's what we have seen consistently. In order for our students, our colleagues as well, to be successful, we should follow a framework. Now, for many of us, that framework aligns with our programmatic outcomes, right? Or our program evaluation and assessment. This is going to guide us in determining exactly what concepts we're including in our classroom, what concepts we're actually including in our courses, our clinical experiences, to ensure those outcomes are going to be met. So experience is your best teacher, so that's your foundation. And then we're building on that by adding resources. So Billings and Halstead and the CNE review book by Dr. Caputi consistently, after surveying hundreds of nurse educators, have been the primary resources. We did develop our own study workbook that's based on colleagues' requests, our early adopters. So that is part of our program and our success framework as well. And then support. Having that consistent support is essential. And there are a number of ways that you can get that support. You're here as part of our social media platform, whether that's YouTube or one of our podcast channels, you're here showing up hopefully every single week to make sure you have evidence-based information that will help you close your knowledge gaps, to not only achieve that passing score on CNE, but also to become a better nurse educator. And then there's other resources, as you can see here from our framework, that colleagues are using to consistently achieve that passing score. I want to talk a little bit about Professor Kennard because I think her story is amazing. She truly is, along with several other colleagues, truly is demonstrating what we say when we mean passing the CNE exam only requires 60 days of commitment. So you can see her timeline. February 2nd, she signed up for the program. February 23rd, she started the CNE in 60 days program, meeting every week for an hour and a half with a group of colleagues where we focus on concepts, only those concepts that are going to help you close your gaps and that align with the CNE blueprint to ensure you are confident and competent when you get to the CNE exam. She completed the weekly sessions on March 30th, and she completed the masterclass on April 4th. So you may wonder, why do you have a masterclass and a weekly session? Great question. What we know is that a lot of information is shared. You have that high cognitive load and overload happens. We want to decrease that. We do that by engaging in micro-learning every week for 6 weeks in the 60 days program. And then at the end, we have this immersive experience, and it's truly that because it is 5 hours of content review where we're clarifying muddy points to ensure that you've closed all the loops, that you've bridged all the gaps, the knowledge gaps that you may have experienced on your 60-day journey. And then on April 22nd, Professor Kennard was successful on the CNE exam, and this was her first attempt. And the importance of this information is to help you see the path. When you're committed and following a plan, a structured plan that's evidence-based, it's going to help you achieve that competency, which is ultimately our goal, but also the confidence you need to walk in and know that you have the information you need to achieve success on that CNE exam. All right, so let's break down those 3 strategies so you walk away with having clarity about exactly what these 3 strategies are that align with tip number 1. So the first strategy is going to be experience alone is not learning. I know it may feel like learning. However, what we know based on David Kolb's experiential learning theory is that we have to be able to make meaning of the information that we are reviewing. So when we're looking at concepts in Billings and Halstead, we can start by memorizing. However, we have to go deeper, right? We have to stop memorizing exclusively and depending on that to help us achieve that passing score. We have to be able to apply those concepts. So what does that mean? When you go back and you look at that detailed test blueprint that's published by NLN on nln.org website, you're going to see when you click on, as an example, credentialing and the CNE section, you're going to see in that study workbook, there's a blueprint. There are several pages that list out all 63 sub-competency statements. You're going to do your self-assessment and have a deeper comprehension about what it is that you know and what is it that you don't know. Again, what we have to stop doing is memorizing because it doesn't help us have that deep comprehension of concept. All right, so strategy number 2 is reflection in addition to application. That's what truly drives clinical judgment. When we talk to students about concepts in the classroom, it gives them that great foundation. However, they have to get to the level of integration and application. Well, we have to have that same experience when we're on the journey to CNE. So when you're looking at those active teaching strategies, or you're looking at page 30 and you see exactly what David Kolb talks about, we don't want you to stop there. We want you to actually integrate, start planning out how you're going to use those teaching strategies in the classroom. The example that I gave earlier is about bringing meaning to those learning experiences. And so what that means is we're looking at exactly how we can add, as an example, the flipped classroom model. We're thinking about that ticket to class and how we're going to make sure students understand those concepts before they come into the classroom. We want learning to start before students actually enter the classroom. So that's what we mean by reflection. Yes, we're going to think about what it is that we don't know. We're going to think about, how did my last class experience go? And what am I going to do differently, the application part, next time so that my students have a better learning experience? That's what helps us also have a deep understanding of concepts in a way that supports the development of clinical judgment. It's hard to teach what we don't know. And that sometimes can become a barrier for us in the classroom. Students ask us questions. Maybe we aren't properly prepared to answer them because we had no idea they were going to ask that question. That's okay. It's okay to say, you know what? That's a really good question. We want to validate that their question is really good. And if we don't know, it's okay to say, you know what? Let me do a little bit more digging into the details to have a better answer for you next week. Or to say, okay, class, Susie has brought up a great question. Let's take some time to all dig deeper before next week and see what answer we can come up with, right? Don't only feel like it's our responsibility to come up with the answers for adult learners, and we want to validate knowledge. It's also about engaging our students on this learning journey with us. We want to use reflection to analyze our answers. We want to make sure that it's accurate information and that students are able to, again, create meaning related to those concepts. And strategy number 3, as faculty, we must intentionally facilitate the full cycle, all 4 phases that David Kolb talks about on page 30. So what does that mean? The first phase says that we have to have that hands-on experience. So that's why we're bringing the equipment to the classroom. We're using unfolding case studies. We're using virtual simulation to help our students make meaning of the concepts. We talk about sterile technique quite a bit. We talk about PPE. Well, let's also talk to students about acquired infections from the hospital, how that can lead to a fatality, an unexpected extended admission. So let's make sure we're helping students get unstuck with any of those 4 phases that they're going through so that students can complete the full cycle. We want to practice clinical judgment questions. This is a simple strategy where we are even using unfolding case studies, or maybe we're using gamification for students to really talk about the decisions that they're making once they recognize that something's not quite right related to that patient. 7-week study plan, that's what we want your plan to be. And I decided just to share a little clip of what that 7-week study plan. You can see, just like with this snapshot, we jump right in. Week 1, you're purchasing your resources. You're going to spend about 8 to 10 hours digging deep into that specific blueprint. That's what's going to help you identify your knowledge gaps. And if you choose to complete the self-assessment exam that is published by NLN, you can absolutely do that. But week 1, we want you printing out that blueprint from the NLN website and doing that self-assessment. Where is your knowledge related to all 63 of those sub-competency statements? So you're going to go through all 63, and then you're going to ask yourself a question. How likely am I to recognize information on the CNE exam when I get to a question related to this concept? Okay, so if your answer is, I don't think I'm at least 70% confident that I am knowledgeable, have enough knowledge about the concept to answer that question, you're going to highlight it or circle it, okay? And then when you get to the end, that's going to help inform you about how many hours you need to spend reviewing those concepts, okay? And you can see from this snippet that 20 to 24 hours for competency 1 and 2. Some colleagues, though, I will tell you, spend closer to 30 hours reviewing concepts aligned with competency 1 and 2. And that's perfectly fine. We just don't want you to have unrealized gaps that don't allow you to spend as much time as you should reviewing that concept, okay? All right, so we've talked about 3 strategies, and now we're going to talk about tip number 1, okay? This is all related to the framework of Kolb experiential learning theory. So tip number 1, in case you haven't picked up on it yet, self-assessment. We have to identify what are our knowledge gaps today in an effort to plan out, to map out where we're going to go over the next 60 days. You're going to use that exam blueprint. You're also going to consider using exam analysis. So that is a free resource that is available on our website, okay, drsellarseducate.com. You will see an exam analysis self-assessment. Once you put in your information, then you will see it. A page will open up, and we'll also send you an email so you can click on it and see where your knowledge gaps are. Because tip number one, have a really good deep sense of where your knowledge is. When you do this self-assessment, that's how you find it out. And then the self-assessment exam, again, that's available from NLN if that's a resource you want to take advantage of. And I will say 50% of colleagues feel like it's helpful. The other half feel like it's not helpful. All right, so we're going to wrap up with our thought-provoking question. I did not forget. I know you all are wondering, for those colleagues that tune in every single week, we decided to change it up a little bit. So we're going to look at that now, and then we'll end our time together for the snapshot. A nurse educator implements simulation scenarios weekly, but notices students continue to get stuck with higher level learning questions. Which revision best aligns with facilitating learning using Kolb cycle? 2 thoughts, just to recap, that you want to think about for every single question on the CNE exam. First and foremost, what is this question really asking me? Okay. Second of all, what is it that I know for sure about concepts that are included in this question? You will have 3 hours to take the exam, and there are 150 questions on the exam. So the first option, A, is increase the number of simulation scenarios to provide more exposure to application and clinical situations. Option 2, or A, add structured post-simulation debriefing with guided reflection and require students to apply concepts in a new case study. Option C, provide a lecture outline after simulation to reinforce correct clinical actions and expected outcomes. I'll give you all a second to think about the correct option. And I want you to also think about the rationale. Okay, so what is the rationale for the 2 answers that are not correct? All right, so if you need more time, you can definitely pause this snapshot and come back. We record snapshots live, meaning that you're getting the information unfiltered, as you could hear my phone ring. And of course, you know how that goes, right? The minute you get on a conference call or that you're recording in my situation, even though the do not disturb is on, there's certain people that can get through, like my children and my husband. So that's what we want you to do at any point. You can pause this snapshot. That's the beautiful thing about our weekly snapshots. And then you can come back and pick up wherever you stopped. All right, so I want you all to give yourself a round of applause if you chose B, adding structured post-simulation debriefing with guided reflection, right? We want to be that guide on the side with our students. However, we want to give them room and space to figure out what the best answer is. And just like you all are doing, we want them to also understand the rationale. As we go through our thought-provoking questions, that's exactly why we call them thought-provoking, because it's not just about choosing the correct answer. The most important part is making sure you understand the rationale, why that correct answer is the right one and why the other 2 are not correct. So let's take a look before we close out. A is not correct because there's no research that says increasing the number of sim scenarios is going to help students truly have this deep learning that we need for them to, right? We want to help them get unstuck by engaging in discussions, by really guiding their thoughts and helping them clarify muddy points. Same thing with C, providing a lecture outline. There's no research that says providing that is going to help them, the students, have a deeper comprehension of concept. Okay, so this is why when we talk about David Kolb's experiential learning theory, we want to make sure we're looking at page 30. We have a deeper understanding as to what teaching strategies are going to help our students get unstuck. And you want to do an honest self-assessment about what your number is right now. So how do you feel about the content we reviewed together today? 1, you feel lost, or 5, you feel like you're ready to teach. No matter where you are on your journey, you're one step closer to achieving success. Whether that is taking the CNE exam or becoming a better nurse educator. This journey is not just about a transaction. Yes, there's a transaction that has occurred. You have given up your incredibly valuable time to show up for yourself today, to become a better nurse educator, to become a better nurse to help transform the experiences that you're developing for your students, for your colleagues, or maybe even for other nurses. The journey to success doesn't have to be one that you take alone. We look forward to supporting you on your journey as you achieve success. It only takes 60 days to achieve that passing score, and we look forward to seeing you in our program. Have a great day, everybody. Take care.